All right. Well, thank you very much. That was sweet of you. Okay. The most excitement I've heard since I walked in the room was when she said we were going to end early. So I don't know if I have much control over that, but I'll do my best. So we're going to talk about pediatric eye injuries, and I absolutely want to hear questions and comments and experiences that you've had with kids, either in your clinics or just out in the wild of the community, your homes, whatever it may be. So let's just talk first. What's the issue here? What are we actually looking at? How big of a deal is this? There's about 70 million kids in the U.S. Any guesses on how many get an eye injury each year? 69 million. So it's only about 1% that this is like a reported in the office, in the emergency room, in the hospital, having an eye injury. Of course, my kids don't go to the hospital when they have an eye injury. So there's others that probably have injuries, but that is about 1% of kids that have a bad enough eye injury to go in to see a doctor. Simple one, boys or girls? Yeah, 75% boys. And actually about half of those occur at home. So a lot of these eye injuries are happening in the home with your kids. Which sport is documented to have the most eye injuries? We got a hockey, we got a baseball, soccer. Nerf, that is not a sport. Yeah, so the one that's been reported to have the most is baseball. And I'll even say in just the last, I think baseball season probably started for the kids 3 or 4 weeks ago. I don't know if anybody knows that, but just in the last 3 weeks, I think I've had 4 orbital fractures from baseballs. So just, I don't even know how to stop that, but be careful. Yeah. How about fireworks? We don't think about that one much. We got the 4th of July coming in a few months. How many of those accidents do you think happen to a person who is not the one lighting the firework? It's about 65%. So while dad's over there really excited to light his firework, there's this little 3-year-old off to the side who ends up getting the injury. So there are a lot of different ways that kids get hurt, and they're just constantly hitting their heads and all kinds of things. So how can we help, first of all, just to prevent this? Really, the simplest answer is eye protection for those activities that need it. It's kind of funny, if you look it up online, the American Academy of Ophthalmology recommends eye protection for basketball and baseball and football and soccer and hockey, and like nobody's going to wear protective glasses for their whole soccer team. But there's definitely certain sports and activities that are more likely to have injuries. And that's your baseball, your racket sports, anything where the ball is small enough to really cause that kind of damage. Paintball, somebody mentioned BB guns, all these things. It's pretty simple to go out and just have a pair of safety glasses for your kid, and you can prevent a lot of troubles. So good luck getting all those, but they actually make some pretty cool sports glasses for kids nowadays too, so they can look like a superhero while they play. And then the other thing is hard to say, but like for you and for teachers and daycare, you just kind of got to be smart with things that are sharp. I see a lot of injuries just from like kids with pencils at school. And so you just got to be careful and be aware of what kind of things can cause injuries. So just out of curiosity, we'll take a moment. What sort of things have you seen in your homes or in your clinics in kids that are memorable to you or that had you worried or didn't know what to do? Any experiences so far? Yeah. With a book? Just like a textbook, huh? Hit the kid and yeah. Yeah, kids are pretty creative with how they hurt each other. Huh? Any other thoughts? All right. Once a child. A Nerf gun? Oh, geez. I'm just imagining you both geared up for your Nerf war at night. Kids are asleep. Okay.
When you were resident, didn't we have a kid with a paintball that had a ruptured globe?
Yeah, we had this string of a lot of paintball injuries for a little while there. That can be pretty serious. Oh. Any other shout outs? Threw a frozen egg at somebody? Wow. Okay.
Chat from
Yeah.
Italian's gonna project it.
Is golf balls inside cause glaucoma.
So we got a golf ball for causing glaucoma eventually. Okay.
My brother caught a fish hook in his eyelid.
Oof, yeah. We might see one of those later. Yeah, those are very common. So that was a boy dancing with an ice pick. Is that what I heard? So the Academy of Ophthalmology did not include that one in their recommendations, but yeah, I mean, these things, go for it. Okay. Kicked in the toe by a sister, or kicked in the eye with a toe. I mean, it's pretty amazing that we don't get hurt more often as kids, but let's talk about some of the things that we ought to know. And a lot of this overlaps with the adult side too. So our simple eye surface injuries, our corneal abrasions, when the big toe hits a kid in the eye, oftentimes what will happen is this is looking at the layers of the cornea here. And if you look, this is coming from front to the inside of the eye. And there's actually multiple layers on the cornea. It just looks like a clear window, but it's got features. So this top one here is called the epithelium. And most often, if you were to get a scratch with a stick or whatever it may be, it's just going to slough off that top layer. It's pretty thin, but it's extremely painful. You can ask any adult who's had one. Very painful, and there's not much you can do about the pain. But the good thing is they also heal really fast. So that can happen with, when we bring them in, we often use a fluorescein dye to be able to see that injury. Any epithelium that's been sloughed away, the area underneath it is what stains with that dye. So it's pretty easy to throw that yellow drop in there, grab a blue light, and find where the abrasion is. But you can also kind of see it without the dye. You see kind of a sloughed off surface of the eye, a little white opaque area. And again, that's fingers and toys and sticks and really anything. Really painful. And a kid oftentimes, one of the more common ways I see this present is they just will not open the eye. And then sometimes you just don't know what's going on. But oftentimes it's because of something like this. They do heal really fast, but the main thing we want to avoid is infection. So it'll heal up on its own. Even if you sloughed off the entire cornea, it's probably just going to be a few days before it heals up. So most of them within a day or two are doing pretty well. So we mostly just antibiotics, drops or ointments. And if they're really in pain and want to put a bandage contact lens in there, you can do that. And that can help a little bit. You can also get actual foreign bodies that get stuck in the cornea, most often metal, but I've seen like bug wings, and I've seen popcorn kernels, and just anything that can kind of get lodged in the front of the eye. And the way that we deal with those, or they can be on the conch, and sometimes you got to flip the lid to find them. The way we deal with those is just to get it out of there. Oftentimes just kind of pricking at it with a needle. You just kind of flick it out is the easiest way. There's a little golf spud, just a little PGA shout out. A tool that you can use to flick it out of there. Sometimes just a Q-tip is enough to just sweep it away. But if there's if it's metal, oftentimes it'll rust really fast, like within the day, and you end up with this ring of rust around it. And so you have to use there's that little spud, but you have to use this burr. It's a little drill basically, and it's got this tip on it that looks kind of like that, and you just kind of drill away at the rust and try to get it out of there. Otherwise, it just keeps causing inflammation and things. So sometimes we can do those. I've done those on kids as young as 7 or 8 in the clinic, and they can do okay. Depends on the kid. Blunt trauma to the eye. So Nerf guns. This is what Nerf guns looked like, I don't know, 30 years ago. And then they kind of got more advanced. And it starts to look like a war zone. Like, yeah, you guys have one of those? Do you have safety glasses though? It's pretty amazing what they've turned into, but they can be really high power and can cause a lot of trouble. So anytime you have a blunt trauma to the eye, whether it's a book or a Nerf gun or whatever it may be, you have a risk of getting a bleed inside the eye. That's called a hyphema. And you can see in this kiddo, things look a little darker over here. That's because, like a snow globe, you've got some blood floating around in the eye. And then as it settles, you get this little layer of blood that forms down below. When we look at this, what we're actually seeing is the blood just in this front chamber of the eye. So you've got your lens here and your iris, the colored part. So just in front of the pupil, between that and the cornea, is where that blood typically is. So when we look at that, important things as a technician to make sure that you're checking or having available is you're always going to want to make sure to look at the pressure. If you can't see to the back, or if the physician's not going to be able to see to the back, then making sure there's a B scan around is helpful. So you know there's no damage to the retina. One important thing in the history is to always ask about sickle cell, which can cause these to be much worse and to re-bleed over and over again, even with really minor trauma. So that's an important one to remember to ask if you're working up the patient. And then to treat these, it's mostly drops, and we use a cycloplegic to sort of dilate, paralyze the iris a little bit for comfort, and then the steroid can help to cool things down a bit. But the biggest thing really is just to make sure the kid's taking it easy. They need to stay upright a little bit so that blood doesn't settle back onto the lens or over the pupil. So you sit them up a little bit, you try to get them to sleep up if you can, or at least on their side. And then you just got to give it some time. But then it's actually at about 3 to 5 days afterwards where they can have a rebleed. And those tend to be worse than the initial one. So they're going to be out of school and kind of down in bed for a week or so. But vision, it'll be affected while there's blood in there, but hopefully once it clears, everything will be fine. One thing you do have to think about though is if you've had a trauma that hard to the eye, it can actually damage the drainage system in the eye. And so once the blood's all cleared, you have to make sure that you go in and you do some gonioscopy. You look at the angle of the eye to see if anything's damaged there, because they can develop glaucoma. All right, which I think somebody had mentioned with some sort of object. All right, if you don't have a bleed, even without the bleed, sometimes you can get what's called a traumatic iritis. And that's where you just get, instead of blood, you just get inflammation on the inside of the eye. And it's actually kind of funny because it doesn't really show up until later. You get hit in the eye with something, doing okay that day. The next morning, the kid wakes up and they're just really sensitive to the light and having some pain and a little bit of blurriness. And that's just inflammatory cells. And again, you want to watch that pressure. You want to get them on some steroid drops and help to cool things down. Even just a couple months ago, I had a kid, again, a Nerf gun, that ended up with a cataract and needed cataract surgery just about 3 or 4 weeks after getting hit with a Nerf gun. So those blunt traumas can impact pretty much any area in the eye. Retinal detachment is another one that you can see, although less common in kids than it would be in adults. Oh, let's see here. More blunt trauma, mentioning baseball season. So the orbital bones, the eye sits inside of this bony cup that's just got a few little holes in the back where the nerves and vessels and everything pass through, but the rest of it's pretty solid bone. And you see how your muscles, you've got muscles on top and on bottom of the eye and on the sides. So when we have any sort of orbital fracture, they most often happen in the floor of the orbit or in this medial wall by the nose. And that's just the thinnest bone is over here. And then when you get hit in the eye, it tends to sort of buckle and break the bone here in the floor. So the thing that we have to watch for, they'll have some pain and bruising and swelling and all that. But you got to watch out for what's called muscle entrapment. So if you get a kid that got hit in the eye and they can't move the eye a certain direction, or they have pain when they try to move a certain way, or they get double vision, meaning the eyes aren't aligned anymore, or they'll actually get nausea and vomiting, or even their heart rate will drop a little bit if you happen to be monitoring that when they try to move their eye. It's kind of a funny response that a lot of you OR people will know about when we do strabismus surgeries. When you irritate a muscle, the heart rate drops. So those are some of the responses we can see to tell us that there's this muscle entrapment. And what happens there is the muscle might get trapped inside of the fracture. It'll break and then it'll come back together a little bit and it can pinch the muscle inside. And so if you see any of those signs, that's something that may require surgery right away. Because if not, that muscle can lose blood flow and essentially die over time. So that's one where we might have to rush into surgery. And when you look at orbital fractures, oftentimes they show up looking like this. This is kind of what most of the baseball ones have looked like lately. And they're just swollen shut. But actually, in this case, the top patient did well, and the bottom patient was the one that needed to be rushed to surgery. Because sometimes in kids, you have something called a white-eyed blowout fracture, where you just get hit that's enough to cause a fracture, but you don't get really anything else going around the eye. But it's enough to cause that fracture to break, catch a muscle, and come back together. And if you look really close over here, you'll notice that this left eye is much higher than the right. because the right one is struggling to look up. So even though it looks pretty quiet, when a kid gets hit in the eye with something that's hard enough, you got to be careful to make sure to look at the eyes and how they're moving, and just be cautious of this kind of stuff.
Or you take them to the lab.
Imaging, you said? Yeah, they'll usually end up with the imaging, and that'll help confirm where the fracture is. And you can actually kind of see the muscles sometimes involved on your CT scans. All right, let's see what else we got here. So now we're into the penetrating injuries. Yeah, so they're hard to avoid because it's not usually during a sport or during, sometimes it's during hammering nails or something like that, but oftentimes you just don't know when this is going to happen. This is a little 6-year-old girl that came in just a few months back and happened to have snatched a kitchen knife off the counter and was doing something with it. And it sort of pulled back and hit her in the eye. Anybody know what this little greenish brown stuff is? I heard vitreous, blood. It's actually the iris. And one mistake that you never want to make with an open globe injury is to try to clean up the eye and wipe things away, because some of those things belong back inside. So she ended up with surgery, had a laceration that was pretty big all through the cornea and then down into the sclera, got sewed up, ended up having a cataract surgery a few weeks later, and then ended up with a retinal detachment a few weeks after that. So pretty miserable one. She's got the eye, but she's got very minimal vision. So, another fishing adventure here. Some of us, a few of you might recognize this picture here, but in order to get this kiddo's fish hook out, we actually had to call orthopedic surgery and ask them for some bolt cutters so that we could try to trim this hook and the big barb and everything so we could pass it through the eye. But this was just a kid fishing with his brother. And again, nobody's going to wear safety glasses while they're fishing. So you just have to be careful and supervise kids when you can. This was another one that came in just a month or two ago, hammering nails with his brother. And it doesn't look horrible when you look at it, but it's enough that he's got this laceration down here, and the iris is kind of coming towards that wound. And then this hazy area here is actually cataract. So he needed multiple surgeries as well. And he's actually doing really well right now. But so many of these things, the penetrating injuries, you just can't avoid. But if you see them at home and you're worried, or in your clinic and you're worried, or you're working up this kid, again, don't try to remove anything or wipe anything away. Don't try to check the pressure. There's no need to. If you're gonna have to cover the eye and protect it and send it off somewhere else, don't put any gauze or bandages or padding or anything over it. Just a plain plastic shield so that nothing's gonna be touching the eye or whatever material might be coming out. If you've got the object, it's always nice. It might help us to know if there's anything that's left inside the eye. But then they're going to need antibiotics and a tetanus booster and some sort of imaging to make sure that there's nothing in the eye, and then eventual surgery. And that'll usually happen within about 6 hours if we can, once they arrive. Eyelid lacerations, another one to think about. And this can be with something sharp or with just a blunt object. One of the things you have to watch for, especially in kids, if they have any sort of damage to the eyelid, you have to think about the tear duct system, and that might need surgical repair. It's a little harder to repair an eyelid if it actually got through the full thickness of the lid, or if it involves that tear duct system. So if we look at our tear ducts, I don't know if you guys know, you can go home and look in the mirror, but if you kind of pull your eyelid down a little bit, you'll see this tiny little hole off towards the nasal side, and there's one up top and one down below, and they sort of combine forces eventually into this tear duct that passes down into the nose. So if there's any injury off to the nasal side of the eyelids, you want to be worried about it involving that tear duct, because if you don't and you just sew the eyelid back together, they're going to end up with just tearing and gunk in their eyes because they can't drain any of those tears. So we'll jump into this one. What do you guys think is the #1 cause of eyelid lacerations in kids? I got a dogs, cats. Seems like it's a pretty wide consensus. Yeah, it's dog bites. which is terrible, right? Fingernails, every once in a while, yeah. But the number one cause is the lacerations from dog bites. So let's talk animal encounters. Any idea what percentage of Americans have a dog in their home? Let's do it. Let's do a raise of hands. How many people have a dog in their home? It's pretty solid. I think we're actually like right on track. So I think it's about 45% of homes that have a dog, which is wild, right? Like that's a lot of dogs. And probably many of those have more than one dog. Dog bites happen in over 1 million people each year. There's only 300 million in the US, so that's a pretty hefty percentage of people, and that's every year. And the majority of those happen in kids. Any idea what the highest risk dog breeds are? I heard pit bulls, chihuahuas, Rottweilers. So the top, now you guys are naming dogs I've never heard of. The top breeds are the pit bull, the Doberman, and the German Shepherds, actually, when you look at studies throughout the nation. Yeah, I don't know. That or just something about their. Yeah.
So this one, pit bull, the German Shepherd, they're at a toddler or small child height.
Yeah, so the dog's face is closer to the kid's face when they're standing, or something about their demeanor. I don't know. But almost every single kid I've seen who has a dog bite to the face, it's their dog or it's their friend's dog. It's not some wild neighbor dog that's running through the neighborhood. It's theirs. And it's always the nicest dog in the world, who just had a bad moment. And that's hard to tell the families. That's hard to tell the parents. Like they always feel so bad, and they always just have to say over and over again that it's the nicest dog in the world, and the kid loves to play with them. But it just kind of takes one moment for the dog to be angry and or frustrated or annoyed, and take a little snap of the kid. And there's some pretty serious deformities that can come from that. So just be careful. If you're having other kids in your home with your dog or whatever it may be, just be careful. More common in toddlers. Yeah, the ones who are, I don't know, grabbing the tails and things like that. I'm not sure. But, yeah. Is there another question? Did I say something? So I mean, overall, the things I'm mentioning are all in the pediatric population, so teenagers all the way down to babies. But you kind of have your age ranges where you're more likely to have injuries. The sports ones are a little older, and yeah. So I've got kids in all those ranges right now. And another sad one to think about is just what we call non-accidental trauma. And it's just kind of a nicer way of saying abuse, right? Abusive head trauma. This is what the retina looks like in a healthy kid. You got a good looking nerve and vessels and everything's pink and healthy. And this is a kid a small baby, who was just kind of shaken out of frustration. A parent who baby was crying too much and just got frustrated with the kiddo. And that is a terrible prognosis for their vision and for their neurologic development. And there's not really anything we can do once that damage happens. And that's actually from when the retina gets shaken like that, the blood vessels just kind of can't handle that back and forth trauma. And it's very unique to abuse. You don't see the same picture with anything else other than abuse and like falling from 40 feet or something really, really serious. So if we see this, unfortunately, we know that it's a bad story at home. So if you're ever involved in a situation like that, your history is one of the most important things, to talk to parents and figure out what was going on. They really need a comprehensive treatment team. They're going to be in the hospital. They're going to be with social work and CPS and a lot of other doctors to look for other injuries. But like I said, very, very poor future for them. So
your obligation at that point? Legally, or
Yeah, so really the extent of your obligation would be to get them connected with the program, the people who will then take the next steps. So that would be Child Protective Services, that would be your social workers. But you are legally required, I'd have to look into this. I don't know. I know as a physician, I'm legally required to report any sort of concerns for abuse. I don't know as yeah, nurses. I'm not sure about technicians.
It's all, anybody with a.
Yeah. So and I would say, why not? Yeah. I would say that we absolutely should be liable. So great question. Yeah. You're straight to the hospital if you're real worried. I mean, if there's just some concern for something else. Yeah, I mean, this kind of thing would be straight to the hospital. Yeah. No, I mean, you may initially catch it in the office, but most often these kids are coming in because it gets reported as some kind of head injury. Oftentimes they say that they fell on the floor or something, and so something else will be off with the kid. Most often trouble breathing, or there's their behavior changes. So, yeah, which is why legally, they'll always call ophthalmology in for a case where a baby might have any kind of abuse, because it's such a strong finding. It's so specific to abuse. Like I said, there's hardly anything else that's going to look like that. So unfortunately, we have to be involved in pretty much all those cases that come through the hospital. Yeah.
So in terms of that very specific image of shaking baby, so it was, which said you fell and split even on one side, what would be the example?
Yeah, so it becomes a little, so the number of hemorrhages that you see, you also see the hemorrhages in many different layers of the eye. So you see it in the vitreous and kind of in the pre-retinal space and in the retina and in the deep retina. And so the way it looks and the extent of the bleeding is just very unique. Stop talking about that. Please. But yeah, so really in the end, all of you play an important role whenever kids are coming through clinics, of course, to help figure out what's going on. But you also play an important role out in the community, encouraging things like safety glasses in your own kids and other kids. If you're involved in a sport that you can find a good reason to protect the eyes from, and you got a good option there. Just be careful with knives, anything sharp. Just keep them out of reach of kids. Keep a close eye on dogs and kind of the interactions that kids might be having with them. Again, I'm sure it's just a dog that was annoyed by a toddler, and don't we all get annoyed by toddlers sometimes? And unfortunately, that's the way they respond. So that's what you can do. And then other than that, just be aware of friends and family members with new kids, first time parents, the challenges that come along with that, and just know people and talk to them and get to know them and see how they're doing. And you might be able to help avoid something like that. But yeah, any other questions about those things? Yeah.
As a part of San Diego, as well as correction, sir.
Thank you.
So there's that. We are really a large team that is running through.
Okay.
And we are taking on pediatric. So are these the cases? Are these some of the cases that we would see at Sawgrass, or is there more specific things?
Good question. You will not. Yeah, you won't be seeing the peds traumas. Yeah, I mean, the things that you will see at an ambulatory surgical center are probably going to be your eye muscle surgeries, your strabismus, your tear duct obstructions. So kind of like the eyelid injuries and the chalazions. Yeah, we're probably not going to be orbital fractures and cataracts and traumas. They'll be staying at the hospital.
Okay.
Good question. Yeah, in the back.
So when you had the picture, it's like it was like weird.
Uh-huh.
It was like months of pain.
Yeah, the hyphema.
So you usually like fix that one like to go out something, or you just like.
Yeah, so those ones will actually clear up pretty well, like this one here.
Yes.
Yep. Yeah, so if you get that blood in the front of the eye, it'll eventually just dissolve and go away. The only time we need to do surgery is if it's completely fills the front of the eye. They call it an 8-ball hyphema because it gets really dark red and sometimes even black looking. Those ones sometimes we'll have to take in to clear everything out because it won't clear on its own. Or we have a little higher chance of needing to go to surgery if the pressure is high in the eye and they have sickle cell disease. So that's why that question is so important. But otherwise, vast majority, they'll do well, they'll clear up. You just have to make sure the blood settles okay and get them comfortable with steroids and stuff. Yeah.
How common is it to see a cataract develop after trauma?
Oh, after like a blunt trauma. So I kind of two categories, I guess. The penetrating traumas, like the sharp objects, it's pretty common. Think about it, it just has to get a little further past the cornea in order to hit the lens. The blunt traumas, couldn't give you a number, but from my experience, probably 1 in every 30 that I see. So it's more rare. Yeah. Any other questions? Just ready to move along. Okay, sounds good.
Questions in the chat? Comments. Usually by the time they got busted already, through all that and are with the guardian, or earlier when you were talking about the intentional.
So if you see like a case of abuse, it's usually coming to clinic after everything's,
Right,
all the acute stuff has happened and they're with a new guardian.
yeah, that's.
Uh-huh. Yeah.
Slides and friggin' pods.
Yeah, that's actually a pretty common one nowadays. They're so cool looking, those little Tide Pods. But kids, they just want to squeeze them. And so yeah, that's another one to keep away from kids. They pop them or they in their eyes or they eat them. The little Tide Pods, the little ones that have like different colors you can throw in the laundry, make it easier. Yeah, lots of things to avoid. But thank you all for your help in taking care of the kids.